Regenerative medicine in itself is a multidisciplinary approach. It really takes a village. It's just about teamwork, and we're very excited that we have active collaborations with basically every single department and division at Wake Forest University in terms of the medical center. And bringing these technologies to patients really does require all these different areas of expertise: molecular biology, cell biology, material sciences. So working together to advance these technologies. As we develop our technologies, it's very important that we keep our clinical endpoint in mind, and therefore we constantly are working with our clinician partners to make sure that as we develop these technologies, we are doing it right, trying to answer their challenges that we can help overcome. My role is really to create teams, to bring up technologies that we can develop, and to really try to make these technologies get to patients, because that's our mission, to bring technologies to patients to make their lives better. And one of the great things about being part of Atrium is the fact that we have this amazing network of hospitals and patients. So it really extends widely the footprint that we can impact with our technologies. And that for us is an important aspect of what we do.